Hello people, in this video we want to look at this pharmacology book by K.D. Tripathi, a very reliable book for medical pharmacology. This is called as Essentials of Medical Pharmacology. So this book is hardbound. Okay, it kind of looks like a law book. You know those law books that you have, lawyers use. Kind of gives that feeling, you know, with this black. So let's get started. So here you have general pharmacology like routes of drug administration, pharmacokinetics, pharmacodynamics, right? What else? Adverse drug effects, how the drug gets metabolized, eliminated. Okay, that is pharmacokinetics. So all the general pharmacology principles. Then you have drugs which act on autonomic nervous system, right? Like cholinergic drugs, anticholinergic, adrenergic, anti-adrenergic, right? So those drugs come here. Example, you have what? Atropine, right, etc. Then coming to autocoids and related drugs, here you will have your paracetamol. When you see here non-steroidal anti-inflammatory drugs, you will have paracetamol coming here. So this is where you can find it. Then histamine, antihistamines, yes, rheumatoid. So basically these are autoimmune conditions, right? Rheumatoid, etc. So they're giving anti-rheumatoid drugs, etc. Respiratory system drugs, guys, the normal cough and all, what will you give? Asthma you'll give salbutamol, etc., right? Hormones and related drugs. This is the section 5. Guys, focus. We are looking at this book. Which book are we looking at? Tripathi Pharmacology, right? So look at this, hormones and drugs. You have pituitary hormones, thyroid hormones, insulin. How will they give insulin? Usually subcutaneous route, right? People take it themselves. Corticosteroids. Then corticosteroids usually will be given for autoimmune conditions, right? Estrogen, progestin, contraceptives, those are also hormones, right? Oxytocin, etc. How's it going, guys? There are a lot of drugs, yes, obviously. Just let's look at the headings. Then nervous system. On the peripheral nervous system, you can give skeletal muscle relaxants, local anesthetics, right? Central nervous system, you have general anesthetics, anti-epileptic, anti-Parkinson, antipsychotic, antidepressant drugs, right? Antidepressant, what and all will you get? Serotonin, selective serotonin reuptake inhibitors, etc., right? They can control your depression if you have. Cardiovascular drugs, what will you know? Nitric oxide, etc., right? Then antiarrhythmic drugs, etc. Antihypertensive drugs, what and all will you have? Beta blockers can be antihypertensive. Diuretics can be antihypertensive. Drugs acting on kidney, you have diuretics, antidiuretics, yes. So blood and blood formation, you have erythropoietin, hemantenics, that is helping the blood form, is it? Then erythropoietin is a hormone, isn't it? From the kidney, which will make more RBCs, right? Then you have the gastrointestinal drugs. So what and all will you give to people whenever they have ulcers? You'll give, name some drugs. Pantoprazole and all that, right? Then antimicrobials, coming to all your antibiotics and all that. So all of them are grouped under antimicrobials. Like you can have antifungal, anti-tubercular, so many drugs, right? So here you have cotrimoxazole, then beta-lactam antibiotics, where penicillin and all will come here, right? Broad spectrum antibiotics, you have tetracyclines, chloramphenicol, your doxycycline and all will come here, right? Anti-tubercular drugs, can you name some? Isoniazid, rifampicin, pyrazinamide, yes, anti-leprotic drugs, dapsone, etc. Then here in antimicrobial itself, you have antiviral also, anti-malarial, anti-helminthic, albendazole, mebendazole, all those. Neoplastic diseases, anti-cancer drugs. Name some anti-cancer drugs. Vincristine. Then what else? So many drugs are there. Cisplatin and all that. Okay. Then miscellaneous drugs. Immunosuppressant drugs. Suppress your immune. When will you do this? Organ transplant? Otherwise, why would you want to suppress somebody's immune, right? Then chelating agents to remove some poisons, like metal poisons if somebody takes, then you will need to give some chelating agents. Vitamins, yes, so you want to give people all the times, prescribe some vitamins to people. Vitamin B12 you'll prescribe folic acid. What vitamins normally? Vitamin C, yes, all that. Then vaccines, yes, vaccines, so many vaccines. Then okay, then what else? That's it. So we're done with the contents of this book. So many drugs. Okay, list of abbreviations. I think before that you would want to look at this book as a whole, right? Wait, let's flip the pages. all the mechanisms of drug action, right? How, and all the classification of drugs. These are the thyroid inhibitors, okay? So this is how the book is, guys. Pretty black and white, right? They didn't put photo of one medicine, one tablet also, right? So mainly classification, guys. Vaccines also, they have classification, is it? Killed inactivated vaccines, live attenuated vaccines. So measles and all that will be live attenuated, right? Measles, mumps, rubella, varicella, polio, the oral polio, all these are live attenuated vaccines. Bacterial, what and all are live attenuated. Typhoid. Have you taken typhoid vaccination, guys? They will give you live attenuated bacteria. And BCG also is live attenuated. Okay. Then toxoids. Toxoids means they are not at all having any organism, right? Neither killed nor live, they don't have any organism. Like diphtheria, tetanus and all that. Those are toxoids. Combined vaccines. Pentavalent vaccines has what? DPT plus hepatitis B plus hemophilia influenza. Okay. There are some special appendix telling the drugs which you can give in pregnancy, drugs which you can give in breastfeeding, kind of a thing. That could be useful, right? Yes. So because these could be teratogenic, right, some drugs. So they are telling you when we are prescribing some drugs in pregnancy, it's better to have no drugs at all. Only when it is needed, definitely needed, then only you give, kind of things. Avoid new drugs, unless they have been, you clearly established safety, right? Don't give newer drugs. And tell them don't take over-the-counter drugs. Give less dose, etc., etc. They have some solution to problem-directed study. You can even calculate the dose and all that, right? Look at this. They're telling you how to calculate. Total volume, distribution, clearance, loading dose, maintenance dose, etc. For which drug are they talking about the loading dose, maintenance dose and all, guys? What do you think? Let's see. Rifampicin, is it? Which drug are they talking about? Rifampicin is known to induce metabolism of contraceptive steroids. So basically, this is like if you have given somebody an oral contraceptive pill, then and if they are taking rifampicin, the metabolism of those can get affected. Okay. So these people can get pregnant. So you should be very careful. That's it, guys. Do you want us to go into details of any of these things, or this is enough for a book? What is this? Let's look at one diagram here. This is muscle. So this is nerve. So the nerve is releasing what? Acetylcholine, is it? What are these dots here? Acetylcholine are being released, and the muscle will catch these acetylcholine and go into contraction. So some drugs will work on this neuromuscular junction. So this is some antibody. What is NR? NR is nicotinic receptors. Okay. So which chapter do you think we are in? Cholinergic transmission and cholinergic drugs. So do you know cholinergic drugs? Can you name some cholinergic drugs, guys? Let's see. Can you name some cholinergic drugs? Anticholinestrases are also cholinergic drugs only. Okay, here you found cholinergic agonists. Acetylcholine, methacholine. Anyways, they don't give you acetylcholine ever because it will get metabolized very soon. So what will they give you? Pilocarpine. Yes, this will they will put for eye. Right? Not much though now. What will it do? Meiotic it is. Pilocarpine, where else will you use? It is, where is it used? So it is used only in the eye as eye drop as of now, looks like. Open angle glaucoma, third line of drug. It's not even first or second line, it's third line of drug. Okay. So basically it is used as a meiotic, guys, to counteract mydriatic. So when you go to the doctor and they have dilated your pupil, then but they cannot send you back home like that. You will not be able to even walk home because of your eye is so sensitive to the sunlight, right? So you can't even ride or walk. So they'll have to put a meiotic before sending you home, right? Or also, even if they want to break this adhesion of the iris with the lens or cornea, then also they can do with the alternating meiotic and mydriatic. As such, so much of pharmacology to read, guys. So if you're choosing this book, it will be good because it's kind of a reliable book for studying pharmacology. That's all, guys, in this video on Essentials of Medical Pharmacology by K.D. Tripathi. Just note that you don't need to, need not know the structure of any drug medicine. You need not know the chemical structure. You just need to know their names. Okay, names, classification. Okay, that's all for now, guys. Bye. Bye bye.